Something that I also want to touch on for the cultural determinants is that we have a lot of Black and Hispanics in the community, is my understanding, in the Baton Rouge and Lafayette areas of Louisiana. And statistics show that 30% of African Americans believe their health is dependent upon fate or destiny, and only about 50% feel that health is a high priority. And for the Hispanic and Latino community, there are about 60.5 million Hispanics living in the United States, and 71.1% of them speak a language other than English. So for you to talk about, having these care providers that maybe don't understand as well those nuances of those cultural differences between communities, it's so important for their care and how they are provided their health care in those clinics. So I just wanted to note that, because heart disease is the leading cause for both of those sets of communities. And so that's just really interesting how well you were able to just segue into everything. So thank you.
No, definitely.
Yeah.
If I could go ahead, Dr. Keller.
Yeah, I think it's really important to understand that point, that just because a lot of people consider themselves Hispanic, there are ethnic differences within the racial group of Hispanic. And
yes.
The same is true for African American people as well. And there are Caribbean African Americans, there are African Americans that are from the United States for generations, and there are African Americans as well. So it's really hard to use racial determination to try to understand someone's social and cultural lifestyle. And it is an important thing to understand that all of these differences exist. And I think an even more important thing is we have, for instance, Hispanics make up 15% of the population, as do African Americans in the country as a whole. But only 3% of each of those groups are physicians. So that means there is a large gap of cultural identification that we are missing by not having more physicians of African American and Hispanic descent. And this is a problem that goes back to medical school and undergraduate. It is a problem that is structural in nature, and one that we will have to have action steps in order to be able to improve those situations, or else we won't be able to have that cultural identification that has been found to be so integral in taking care of patients in historically underserved communities.
Well, Dr. Keller, you bring up one aspect, and that's education, and it really goes back to lower elementary education. It's a sad generalization, but it's one that, tell me your zip code where you were born, and I will tell you your ultimate resting place in society. And it's just unfortunate that it is difficult to move up the societal ladder, with education being one of the main things that leads to almost eliminating the majority of the social determinants of health. And we hadn't even spoken about violence in the communities in these areas. So, if your zip code is going to determine your outcome, there's a lot of work that we need to do so that people can break out of that, generalization.
Absolutely. Isabel Wilkerson wrote a book recently called Caste, The Origins of Our Discontent. It really opens your eyes to a lot of things that have gone by without you even noticing them in our society. Really, really fantastic book. I highly recommend it to everybody.
Yes.
If I could be Sabrina somber for a minute and just be honest, unfortunately, Dr. Keller and I both on this fireside chat, medical doctors, highly educated, board certified. In that, and we can transition this conversation to your next segue, our education levels, our income levels, and our relative comfort in life have not changed our life expectancy from other African Americans or people of color that have not achieved the same educational income levels that we have. Mm-hmm. So it's something that's definitely deeper and systemic that needs to be addressed, that if you could have someone that is worried about their next meal or a roof over their head versus someone who may live in the suburbs and gets to choose what they want to eat or drink every evening, that unfortunately, as far as life expectancy, the numbers are nearly identical.
Right. Yes, that's a really great point. I think there's also a point of so healthcare professionals, you were talking about how you know, I can already tell you treat people the way, you know, you would talk to a person having a conversation as a healthcare professional. And that's just fantastic. And so I'm just curious, how have other healthcare professionals that maybe aren't of the similar cultural backgrounds or racial backgrounds or aren't as aware, what are they trying to do to address these determinants in their own communities that you've experienced firsthand, maybe?
I've had a lot of interest across the spectrum of providers to participate with us in our HeartSense community screening programs. And the programs have been fantastic because they have really shined a light on how people in the community view physicians. And we've been able to break down a lot of barriers with regard to hesitancy because of a distrust of the medical establishment that has evolved out of experimentation like the Tuskegee experiment or the sterilization of women with C-sections in the 60s and 70s. So we really have come a long way by going out into the community and bringing physicians from all different areas of the country into our community to be able to touch people and to show them that we can give them care that they don't have to be suspicious of. And that's been a big deal for us. And it's been a big deal to help educate the worldwide community about how these kinds of things are possible and how we have many, many people in the community who want to contribute to this kind of an endeavor. And it has been very fulfilling for me to be able to convince people like Dr. Andrews to take time out of his day and to take time away from his practice to come and contribute to a project like ours. And we are grateful to him and to all the other physicians and healthcare providers and nurses and nurse practitioners and even health ministry people at the churches that we go to for welcoming us into their communities and for coming to help us to spread the word about structural heart disease and chronic heart disease in general.
Definitely. And the events that I've been fortunate to attend have just been completely holistic. I mean, you walk in and you have this vast array of different people in different backgrounds, you know, even employment, you know, professional backgrounds, all coming together to provide those health screenings, those heart screenings. So they've been really nice events and really open, and everyone there on both sides of it, the people providing the care and receiving, have all been open and grateful. And it's been really a nice, warm experience.
Yeah, and we're really limited by the number of people that catch on and realize that we're trying to do something to be able to turn the tide of chronic disease and to help people who would not normally have been counted to be counted, and to be able to have the access to the kind of diagnostic technology that we provide. Yeah.
Definitely.
Wow.
And Sabrina, I know when I've been there, you bring up the technology. I mean, when you talk about, you know, the butterfly ultrasound, you talk about the echo, you know, EKG, stethoscope, you know, Medtronic being available there. It is just an awesome experience, and something I've been glad to be involved with. But that's just technology that just doesn't show up on the corner.
Right.
Available to
Yes.
screen people in a church.
Right. Exactly. These These patients are
Yeah.
getting access to amazing technology that's able to detect, heart murmurs or something that's a little bit off with their heart rhythms with the echo devices. And then with Butterfly to go into that ultrasound to go a little further. And then the fact that if you do get something that seems pretty serious, you actually take that next step with that patient and make sure they're going to receive the care that they need. So it's just phenomenal. And HeartSense is such a fantastic organization.
Definitely, I agree.
Let's see. It looks like we have covered everything for today's fireside chat series.
That was
And
awesome. That's my
yes,
favorite one so far. You
thank
guys
you
did
so
such a great job.
much.
We need 2.0 because I have more to say, man.
Yes. Okay. So everybody,
Good. We can have him
community.
be a regular.
Part 2.
We need Dr. Andrews to be a regular.
Yes. So community, let's go for a round 2 with Dr. Andrews in another fireside chat, and let us know in the comments or send us a message of what you think we should talk about next with him. And we'll definitely have Dr. Andrews on with us again for the fireside chat series. I'm Sabrina, your host. Thank you so much, Dr. Keller, Dr. Andrews, for your time. This has just been a wonderful conversation, and I can't wait to continue it.
Thank you, Sabrina.
Thank you.
Bye.